This is great. I'm going to start now, and my colleague in the background will admit if anybody else is okay. I can see that my colleague is on board in the background. So I want to welcome you again. We're not having an open interactive session, so you will see me on the screen and my presentation. And please feel free to use the Q&A option as and when you wish. I will not stop talking until probably near the end. I won't take very long. I will try and allow some time to ask any questions that you may have. We have allowed about an hour and a half, but these sessions usually are shorter, but we are able to go all the way to the end of the session if we need to. So just to introduce myself once more, I'm Dr. Hara Truly. I'm a medical doctor. My training is in orthopedics, but I also have a music degree. And that prompted me to explore a little bit more the world of performing arts medicine. For those of you who don't know performing arts medicine, it's a fairly new, let's say, subspecialty of medicine. We are probably where sports medicine was about, let's say, 15 years ago. Sports medicine now is quite a big specialty. It is in a lot of the training systems in medical school in many countries. Performing arts medicine isn't, but it has emerged as a subspecialty and as a very strong special interest for a lot of individuals around the world. And I'm going to give you a few comments as I give my presentation to give you an idea of where this field of medicine is and what may trigger your interest if you wish to study with us or look in a little bit more into performing arts medicine. So I'm going to share my presentation. Give me a second. I'll try and move this out of the way. I just have the one screen today, so I hope you can see my presentation. Emiliana, my colleague, if there is any problem, perhaps you can let me know. Okay, so Performing Arts Medicine, or PAM for short, PAM, is what we teach here at UCL. The course is under the Faculty of Medical Sciences and the Division of Surgery. You may ask yourselves why, how come Performing Arts Medicine is under these sections? Well, medical sciences, I suppose, makes sense. The Division of Surgery was the division that kindly adopted this course almost 15 years ago now. So we're very grateful to them, and they are a wonderful division with a lot of interesting other courses as well. And Performing Arts Medicine has been hosted under their arms for the last, as I said, 15 years. We have a master's program, the MSc. We have a postgraduate diploma, the PGDip, and we have a postgraduate certificate as well, which is the PG Cert. Most of our teaching and work in general, including dissertations, these days is done by distance learning online. And we have a small part of the studies and our examinations that are done on campus for the master's and the diploma students. I will give you more details. So Performing Arts Medicine, I suppose, comes a little bit as an unknown subject to many, but I'm just starting my presentation with this sort of show of books. These are textbooks that have been written over time. You can see textbooks in a musician, the musician hand, mostly dance, of course, dance medicine, mental health, Playing Less Hurt is more of a musculoskeletal book, but it has a lot on the mental issues. Voice problems for people who talk or sing in performing arts. We have the science or the biology of musical performance. We go again into the actors, the acting performance. So we talk a lot about the psychology of acting, a very, very interesting subject indeed. And then we have performing arts medicine in clinical practice. So how do we actually do it in the clinic setting? The performing arts medicine textbook here in the bottom right is probably the most comprehensive textbook that we have to date. And new subjects such as circus medicine have emerged. You can see here a applied anatomy of aerial arts. And these are just examples, really. There are many more books that we see now on the shelves online. Of course, a lot of them are e-books. And as I speak to you now, I'm participating in 2 new handbooks that they are written in present time, and we're hoping that UCL will also produce a textbook in the next few years. Not only books, but journals as well, scientific journals, and I'm showing you again a few examples. The one on the top left, The Medical Problems of Performing Artists, is probably the most focused performing arts medicine journal. It's an American publisher, but it's an international scientific peer-reviewed journal, and you will find a lot about our specialty in there. And it's been published for many years, probably 20 years now. Other books like occupational medicine or other medical scientific journals. I'm sorry, I didn't mean to say books, I meant to say journals. The Frontiers selection of journals, scientific journals that very often will have articles and scientific papers on performing arts medicine. The Journal of Voice, again, an international peer-reviewed journal. The Journal of Dance Medicine and Science, again, similarly, an international peer-reviewed journal. And the British Journal of Sports Medicine, BJSM, hosts quite a significant number of performing arts medicine, particularly the ones on dance and circus. The French publication you see there in the middle, Médecins Arts, it's not a scientific peer-reviewed journal, but it has a very, very good selection of interesting papers on performing arts medicine. And of course, having given you this introduction, you can ask, who are the people who come and study with us? And I can say with certainty that we've had a very, very interesting and diverse group of people in our alumni. Our alumni now is more than 100 graduates and from all backgrounds of professional studies or careers. So just to give you an idea, we have had health professionals such as medical doctors and biomedical scientists of many backgrounds, not only musculoskeletal, but also voice specialists, laryngologists, psychiatrists, general practitioners, quite a lot. Of course, we have physiotherapists, osteopaths, chiropractors, sports therapists, athletic trainers, kinesiologists. These are professional qualifications from different countries, not the UK, but we do accept them. Psychologists, speech and language therapists, but we also have quite a significant number of dance or music or circus, I would say, performance scientists. So people who have actually been or are performers themselves and would like to dig in a little bit more into the health sciences of their craft. And of course, next to them, we have an interest from performing arts educators, the teachers in the colleges, in the academic institutions where performing arts are taught. And we do examine in our extended curriculum how we care for musicians, dancers, circus performers, singers, actors, and many others, backstage performers as well, technicians, crew, a lot of people that take part in the productions. We are the only postgraduate degree. I'll try and move this a little bit from the screen there. It goes there. It's a little bit. I'll try and hide it. I can't hide it very well. I'm so sorry. It was better before, I suppose. Okay, I'll get on with it. So 14 years, 15 coming September. UCL is the only postgraduate degree at master's level. So we're very proud of this position in the world. Of course, you know, we would like to see more courses around the world, and we are going to be helping anyone who would like to set up these courses. But UCL has been the pioneer. I suppose will be considering the fact that we're still the only ones. Now, let me give you a little bit of outline of what the course is like at UCL. So, as I said in the very beginning, we have a certificate, a diploma, and a master's. Every option of these three has some sub-options, some more options. So, if you want to do a certificate, this is 4 modules only. It's totally distance learning. And you can do it in 1 year, all 4 modules, or you can take 2 modules in the first year and 2 modules in a second year. That's the flexible option. So that's the certificate, 4 modules. If you then want to do a diploma, and for you who have an interest in how this is built up, you can start from a certificate and then upgrade, or you can go straight for the diploma or straight for the master's. The diploma has 8 modules, so twice the number of the certificate. It is done distance learning 95%, but the students will come to London at UCL on campus on the last year of their studies for 2 residential weeks. The same happens with the master's students. The master's students have 8 modules, the same as the diploma, and they have 1 extra module, which is their dissertation, their research dissertation. And the master students will have most of their work as distance learners online. They will come to London for the 2 residential weeks during the last year of their studies, and they will also do a dissertation. Now, the diploma and the master's have some options that you might want to consider. You can do them in 1 year. That's a lot of work and usually doesn't allow much free time in a sense of doing other studies or working, or if having heavy, life commitments. But you also have the option of a part-time study, which is 2 years. So really divide your work between 2 years. And we also have a flexible option up to 5 years. And I have to say, some of the people who have other commitments in life, professional or personal, they do go for the flexible, or they convert to a flexible option. You can do this within your, let's say you've chosen a full-time option and you find things that are a little bit tight. We have mechanisms that we can convert students to modular, which means that they will then have up to 5 years. It doesn't have to be 5 years, it can be 3 or 4, but you can divide your time and your work in that space of time. And just to let you know, and I'm sure those of you who have an interest may have seen the actual modules on our web pages at UCL. But if I can remind you what we do, the 4 modules that are common for all options, all courses are performance psychology, science of dance, circus, instrumental music and voice, and general occupational risk factors in performance. These are the 4 modules that everybody will go through, whichever program they select. Now, if you select to go to the diploma or the master's, we have 4 extra modules. These are mostly on musculoskeletal injuries. So we have a module on the injuries themselves. We have an extended curriculum module talking about pain, chronic pain, and disability in performing artists. Then we go into another extended module, which is how to assess and rehabilitate the performing artists. And we offer one more module for all the diploma and master students, the research methodology, where you're taught how to read and write scientific papers and do research. For those of you who will like to go all the way to the master's, then we add a dissertation, which is a longer module. It's 60 credits, as you can see, but it's the opportunity for those who have a strong interest in this work to produce some original work and take this a little bit later into perhaps a conference or even publish. We have no other modules such as optional modules. And as I said earlier on, if you wish to start from a certificate and consider upgrading, that is also possible. Each online module is about 30 hours of teaching time altogether. The lectures are recorded and they're placed on our teaching platforms between October and March. So as you understand, there is a flexibility there as well. We have certain days and times of the week that we upload the lectures, but you as the receiver, you don't have to be there on that day and time. You can go through your lecture a little bit later on the day or a little bit later in the week. We do encourage, of course, people to keep track of what is happening, because eventually you will have assessments and assignments, but you don't have to be there on the day and the time. And I'm saying that because I have quite a few questions by email or other ways where they ask, oh, do I have to be present? So if, let's say, you're working on a Thursday afternoon where we put on our psychology module and you can't watch it, then it's absolutely fine. You can watch it on Friday or the weekend, or as close as possible as you can. We do offer resources and links for independent learning, and we encourage people to really go into those extended learning options. We have some forum discussions which are online and a few live sessions. And I'm saying a few only because we have an international cohort. Time zones are very different, and we have to respect everybody's time and availability. So we will have 2 or 3 sessions maybe every term, and we will announce them and notice them. And if you can't make, we will record them and we will put them on your teaching platform. And as I said before, the diploma and the MSc students will come on the final year of their degree. They will come to London for 2 residential weeks. So to give you an idea of what is happening right now, next week after Monday is a bank holiday here in the UK, but from Tuesday onwards, all our students will come from wherever they are flying in from. We have Australian student this year, we have a student from Puerto Rico, we have Far East, we have a couple of Europeans, so they will all be here. We know them, we have spoken to them online, but it will be a great opportunity to meet them in person. We have a revision time, a refresher week, lots of questions, lots of discussions going on. It's very, very, very live 2 weeks. Then we have some oral exams, presentations, poster displays. We go out for drinks and dinner. We go out and see a play. So we try to make these residential weeks as memorable as possible. And I think we have succeeded. Everybody that has been in those residential weeks now for the past 4 years after COVID, we've had amazing time. We've been getting to know each other, and a lot of friendships have formed as well. So it's quite a highlight of our program, I would say. Maybe I should say that if you are thinking about a certificate, you can still come and meet us during the residential weeks. I've just been speaking to two of our certificate students this morning who will join us for parts of the residential weeks. But again, it's an opportunity to come together and get to know each other. Our assessments, they are as diverse as they can be, really. I'm just giving you examples here. We have essays, presentations online, written blogs. We sort of try to appraise scientific literature. We have some written examinations like MCQs, or we give you some clinical scenarios for a week, depending on the module, really. I'm not giving you every single detail here. And then for those who come for the diploma or the master's for the residential weeks, we have some clinical examination, a clinical assessment of the patient, that is. So we will have those live. We display some posters that the students design, and we have some infographics presentations. And the ones who do the master's and have a research dissertation, again, have some options. Some students want to do something more original. So we go through perhaps an ethics process here at UCL to get approval for an original study. But some students are fairly remote, or don't have the time, or don't wish to go into an original study in that respect, and they may want to do something a little bit more desk-based, like a literature review. So again, we do have options for that, and we try to cater to everybody's needs and availability and time. So for the entry requirements, so you will see those, I think, fairly well described in the application processes that we have. But just again, to summarize, for the diploma and the master's, we do need either a medical qualification, UK or other, doesn't matter, our cohort is very international, or a bachelor's degree in physiotherapy, osteopathy, chiropractic, nursing, sports science, biomedical science, athletic training, and more. For the PG Cert, the certificate, we can have all of the above, but we can also accept psychologists, speech and language therapists, and graduates from performance. So I think I mentioned it earlier on, but we do encourage the application from performers who have an interest in health sciences. It is very important, and Performing Arts Medicine has tried to do that. And if you have been to a conference or planning to go, you will see that there's a mixture of health practitioners and performers and performance educators. It's a bridging specialty, and we need to learn from each other. So we do accept graduates from these disciplines as well. If we need to discuss with you who you are, what you have done, and what your aspirations are, we are very open to having a Zoom session or something like that to give you a little bit more insight and understand what you wish to do with a course like this, perhaps. So what I'm trying to say is what I'm showing you here on the screen are not the only backgrounds that we accept, and we do see everybody as a single case, and we will discuss if that's the case. And I'm sure you want to know where our graduates go and what they do. And again, I can say there are very many options there. I could think of a few examples of our graduates, but what really this knowledge will take you to, and the skills you will hopefully manage to acquire from studying with us, is in the clinical settings. A lot of people go into independent clinics and they set up those performance clinics, and some of them are very, very successful around the world. A lot of people work as in-house clinicians or advisors in music, dance, circus colleges. Equally, in the industry, you will see quite a few of our graduates working with orchestras or dance companies. Or if you live in a country like the United Kingdom here, we have a lot of musical theatre companies, opera as well, and a lot of the graduates will go and work with the staff and the crew on those musical theatre performances. Some of our graduates work in sports medicine clinics and rehabilitation clinics, so taking a little bit on the wider spectrum of musculoskeletal injuries. And there are now some dedicated circus medicine clinics. Circus, of course, we refer to circus, if I may say, the Cirque du Soleil type of circus, where people are more athletic, and they perform the rather interesting, I would say, acts that we try to explore and care for. A lot of the graduates come back either to us or elsewhere in their own countries, perhaps, as educators in performing arts medicine. We have had graduates who have set up their own courses, in mini courses, perhaps in their own countries or online, and this is wonderful to see. And of course, there are those who have the bug of research and want to go a little bit deeper. They may have a biomedical science or other science or performance science background and wish to explore a little bit more research in performing arts medicine. So we have some options for a short fellowship, perhaps, with us. And of course, if people want to do a doctoral studies, PhD, then again, we will advise you how to carry on with that. I think a question that comes often, I don't like to put it on the slides because I'm the last one that actually deals with this, but a question that we have usually in these webinars is about fees. So I've just put up the fees for 2025-26. That's from next year onwards. It's not the current year, it's the year after September. So this year is cheaper, I would say, but this is where it will be from next September enrollment. You can see that there are two options, whether you're a full-time UK-based or Ireland, Republic of Ireland-based student. That comes as a full-time or higher fees, again, as a full-time, part-time option. And this comes into every course, the master's, the diploma in the middle, and the certificate at the bottom there. Because we have the modular, the flexible modular basis, which means that you have the option to select modules per year and take, for example, your master's up to 5 years, then of course the fees are very different because you pay only for the module that you enroll in. That's if you have selected a flexible option. So just an idea there, but if you want a little bit more information, a little bit more detail, then we can signpost you, or feel free to email me or my colleagues, and we will give you a little bit more detail about fees. Just to let you know that we don't do only academic studies. We have other events that we usually put up. And this is an interesting event that we are planning to have now on the 21st of June here at UCL. It's a face-to-face, it's an in-person event. if you are around or you're hoping to be around, we will very much like to see you. If you put in your browser PAM Day, PAM Day, UCL, this will come up. It has a cost of £95. It's an all-day course, and it's really an introduction to performing arts medicine, and you will get a certificate in the end for attending. So if that's something that might interest you, and we talk a lot about the courses there, and of course there is some interesting talks from our tutors. If you're interested again, or you want to know a bit more, please email me. I will get back to you with the details. And finally, I'm putting this slide up because this was a big event for us last year. It was the International Symposium, Performing Arts Medicine. For those of you who have come across PAMA, Performing Arts Medicine Association, that is the American-based, USA-based association that every year has a PAMA symposium in the United States for many, many years now. And last year, we were very, very honored and privileged to be asked to host the symposium for the first time outside the United States of America, and we had it here at UCL. It was a great conference, as you can see, in July last year. It was, you can see a couple of slides there from the actual conference. We had 400 attendees from almost 40 countries in the world. It was a very it was inspiring and such a wonderful time to be all together in London for 4.5 days. And I should say, it's not really a secret, but we are planning to continue with the help of our students and graduates who are always amazing in helping out and presenting themselves. We're hoping to put a more regular UCL conference in performing arts medicine together very soon. So this is what I had to say to you. Use those 2 emails if you want to get in touch. The first one, the DSIS, is our generic email. But if you want, since you've been with us today, if you want to speak to me, that's my email at the bottom there. And I'm sure you have the links to the programs if you want to see a little bit more on them. If you don't, you can always let me know. So I'm going to stop sharing now, and I'm going to check if there are any Q&As, or if you want to ask any questions. That will be wonderful. I want to thank Emiliana because she has put quite a few links there. Thank you so much. Emiliana is my colleague from the Faculty of Medical Sciences. I'm sorry, I can see roughly your names, but I can't see your faces. It's just how the webinar has been set up. I'm just going to go into this Q&A, and I can see there are no questions there. But Emiliana, can we open the mics if anyone wants to fire a question, perhaps?
Hello, everyone. Yes, mics are open. You just need to unmute yourself if you want to ask a question, or you're welcome to use the Q&A box to write down your question.
Thank you, Emiliana. Yes, feel free. You know, we have a few minutes. If you want to ask any questions that comes to mind, I'm here to answer that as well. Or even just introduce yourself. That would be nice, I think, for me to see where you are, where you're from. If you wish to say who you are and what you're doing, that would be interesting to us too.
We do have a question in the Q&A box.
I saw it. Thank you. Do you accept bachelor's degrees in occupational therapy as well? The answer is yes, we do. Very much so. Just to expand on this a little bit, occupational therapy is very, very, the work is very close to us, as is occupational medicine. If you think about it a little bit more, performing arts medicine is an occupational medicine specialty. It really digs into the problems, the health issues that performers have who are, in their occupational capacities. So occupational therapy goes alongside. Particularly, we have had interest from people who do hand therapy, occupational therapy in hand therapy, sort of hand therapists, but others as well. So yes, if you have an interest, we would accept that. The admissions process is led mostly by UCL admissions. They go through the generic sort of paperwork, your degrees, your transcripts, references, language, things like that, which take a little bit of time if you're thinking of applying. It takes a little bit of time. We my team in the Department of Performing Arts Medicine, we don't see the applications until a little bit later. So when they're cleared from the admissions team, they will come to us for a final sort of confirmation of an offer. And as I said a little bit before, if we do need to have a chat with you, if we might not understand something very well, or we try to see what exactly you want, we're very open, and we do organize a quick Zoom session with you at a convenient time, just to make sure that we are the right course for yourselves. Any other questions? Anybody wants to, or has any ideas or comments, or as I said, wants to just tell us who they are?
Hello, good afternoon.
Hello there.
Hello, I'm Saleh Habib, so a
Hello,
physiotherapist from
Saleh.
Hello. Am I audible?
Yes, I can hear you. I can hear you. Tell me what you want to ask.
I'm a physiotherapist from Nigeria, so I want to know if a physiotherapist is applicable to apply for this Performing Arts of Medicine, MSc. And is there any way of like funding for the fees and the tuitions? Thank you. Thank you for the presentation.
Thank you. You're very welcome, Saleh. I didn't catch the first question. I think your second question was about the about funding. Emiliana, can we? I don't know if you have already. If we can put a link to our the funding options. We don't have a scholarship or something like that in our department. But you can look at funding options for postgraduate students. And if you look at the chat, Emiliana has just put that link in there, Saleh. But what was the first question? I didn't quite catch it. I heard you saying you are from Nigeria. So what was the question on that, if you don't mind repeating?
Okay, I said Nigerian, physiotherapist from Nigeria.
If we, again, I'm so sorry. I think I'm not having a very good connection with you. I think you're asking me if we've had people from Nigeria in the course, or if we would accept. And the answer is we haven't had one, as far as I remember. I think I've talked to a couple of graduates from Nigeria before. I'm pretty sure I have, because we had opened a conversation about Nigeria and the situation there with performers, but we haven't had someone applying yet. But there's no reason why we shouldn't. As I said, the admissions at UCL will go through your qualifications, which university you went, what degree you've done before. They go through that, and they will confirm that you are eligible to apply. So that comes at the very early stages of the application process. If you wish to do an application, even for a certificate, do take your time. A lot of students, we see a little bit of a push towards the end of the summer, where the deadline is, this is the English summer, August. And then it kind of gets a little bit tight with time, particularly if we need to, if we have some questions and things that are a little bit, and they need more communication. So if you are having thoughts, the earlier you apply, even if you don't have references ready, even if something is missing, it's better to apply a little bit earlier to give us the time to look at your, to look at what you're sending us, so UCL can actually process that on time, and you can make your plans, of course, for next year or any year, really. I hope I've answered your question, Saleh.
Yeah, you do answer the question. Thank you very much for your
You're
answering the
welcome.
question.
You're very welcome. Thank you. Okay, great. Anyone else? Something comes to mind? I have questions. I'm going to go into the Q&A. Okay, thank you, Emiliana, for asking that. It's about the international funding. I'm going to go to Geraldine's question. I'm just going to read it out. Geraldine, thank you for sharing. I'm a speech therapist, work in Singapore. I work with voice patients. Very, very interesting. I was just talking to Singapore just before this webinar. I was interested to find out more about the differences between PG Cert Dip and Masters. It seems like the modules that are relevant for my clinical work are the compulsory modules which fall under the PG Cert option. Are there plans to further introduce more voice? Oh, Geraldine. Okay, well, if we had the time to do it, I would say yes, that would be great. That's why you may remember, or you may not have seen the detail, when I put the speech and language therapists as as an option for recruiting, I put them under the PG Cert. I'll tell you a couple of stories there. Thank you for the question. It's interesting. We had 2 or 3 speech and language therapists that have done the PG Cert and stopped, and then we've had an equal number of speech and language therapists who did the PG Cert, which has the voice module plus everything else. It doesn't go into the musculoskeletal examinations, for example, because it's a certificate. But the speech and language therapists do the certificate. But a few of them, for personal reasons that, just their interests, I suppose, they have asked to upgrade. And UCL and my team, when I say my team, I mean my module leads and the professors we have that deal with this course, we have accepted that. And they have done a really good job. It comes as a challenge because obviously when they do musculoskeletal modules, it's not something that they know or they have done in their previous studies, but it was an interest upgrade. So to answer the question, if we are planning to do any more voice modules, the answer is no, not at the moment. We have what we have, and it's not up to us, it's more up to the ear, nose, and throat department if they want to do anything more. But we are offering options for certificate students to do research as well. I didn't go into detail about this, and perhaps you can email me and we can have a chat, see what exactly is going through your mind. But we do have students who stay on or decide, since they are UCL students, to take advantage, if you like, of the UCL ethics approval mechanism and go into original research studies with the supervision of our voice professors. So that is the answer to your questions about the expanded modules or options for speech and language therapists. Please email me and we can see what you're thinking. Speaking of Singapore, Geraldine, nice to meet you. We have a very interesting team in Singapore These are from people who have done our course already, and they have returned. A couple of them have returned as tutors, as lecturers on the course. Excellent collaboration there. And I don't know if you know, but there is a special interest group that has been formed in Singapore. I think they're under the Sports Medicine or Sports Rehab Association there, and they do have some events related to performing arts medicine. So if you haven't come across them, and if you would like to know a little bit more about these connections, again, do send me an email, and I will let you know who they are and what they do. I hope I've answered this question as well. And just go into the okay. Oh, there's no other question. I thought there was. Okay, anything else? Let's see. No problem, Geraldine. Yes, as I said, do email me if you would like to know more. Another question, would it be possible to consider having an online version of the Intro to Perform one-day course for professionals overseas as well? Yes, the answer is yes, and it's actually yes to much more. Sorry, I don't know who sent this, but I'll tell you that what we're doing. We try not to overload the program. We're a small team. We don't have an option to do a lot of, let's say, extracurricular events. We do the PAM Day every year. We have a few other more local days here at UCL in person again. Last year, we undertook this big conference that I showed you, the international conference, and we're hoping to do this again, well, not again, but a similar, smaller scale event in a year or so. But we're also planning to start a range of CPD. CPD, I don't know who is asking the question, but CPD stands for Continuous Professional Development. So in other words, short courses, a little bit like the PAM Day, but a little bit also more focused. So for example, a course on voice, or a course on mental health problems, or a course, let's say, on hypermobility, which we see a lot in performing arts. So the answer to the question is, we don't have anything additional at the moment for the overseas people, but this is one of our priorities, and we're hoping in the next year or so to build these courses, which are going to be online, and the overseas professional people that want to do those without, of course, coming to London will be able to do those. So thank you for the question, and it's a great reminder that there is interest out there, and we hope to be able to cater for that, even if you don't enroll on our certificate or diploma or master's. Great questions, by the way. You're just prompting me to think about things again and again. Thank you so much. It is, I have to say, everybody comes from a different background. They have different availability. It's amazing how many different situations we have seen over the years, particularly since we've gone on the online version. For those of you who don't know, 5 years ago, before COVID, we had the course online only. So we would have people from abroad, but we would have mostly UK-based students. Now with the online version, we have international cohorts, and we would like to help in providing more education, training, knowledge, resources for people that are in different countries and are unable to attend the full courses or unable to attend events that we do here in person. So yes, thank you for the question again, because this is something that we have in mind. It's just that it has been a very busy year for us with our international conference. And by the way, just to mention that this year's American, or if you like, international conference is taking place in Washington, D.C. in July, if you have an interest in that as well. And there are more conferences, actually, thinking about it. There is the Scandinavian Conference, Performing Arts Medicine in Denmark. That's in September. There is the International Dance Medicine Conference. Forgive me, I can't remember where it is, but it's in October. My memory it's gone for a minute. And there is another big conference in Shanghai in China. If you are living or around that area, that part of the world, Shanghai is in very beginning of November. That's the International Symposium in Performance Science, and it's a collaboration between Shanghai University and the Royal College of Music here in London. So that's a great conference, again, if you are based in that part of the world. Thanks, Emiliana. Yes, that's the PAMA conference. That's the one we had here at UCL last year. This year is back at the United States for the Washington, D.C. I'm just reading the question. Apologies, I came into Zoom late. Would just like to clarify the difference in terms of career paths. If were to take the PG MSc versus PG, if there are any. You know, I'm tempted to say there aren't any, in a sense of, let's say, I don't know what you do and what you're thinking really about. Any of these qualifications in your CV, let's put it this way, practically, can bring you in an area of work that you would like to offer for the performers. So let's say, for example, and I said, I'm sorry, I don't know who you are, what you do, but let's say you're a physiotherapist and you do the PG cert for whatever reasons, financial reasons, time reasons, you know, whatever are your circumstances. Putting the PG cert, a certificate in performing arts medicine, it's a postgraduate degree. It's not any certificate. We call it certificate, but it's a postgraduate certificate. So it comes as an academic degree. Can take you as far as the other courses. So the question would be, why should I do the diploma or the MSc? The first answer to this is because you may want to go a little bit deeper into the musculoskeletal work, or you might want to go deeper into research. A lot of people come to the course because either they come from a musculoskeletal background, like a physio or maybe a doctor or an osteopath or someone else, and they want to expand and work on their clinical skills more and learn how to assess musculoskeletal health in performers. When I say that, you have to imagine, let's say, for example, an instrumental musician, let's say playing the cello. You will learn a little bit more about the cello, about, you know, the dynamic postures of the cello, of the cellists, and also you will learn about how an injury can occur and how you can help correct it. So that's the in-depth in the musculoskeletal work, but also people will come into the masters because of the research. And a lot of the students that have applied and have graduated for the course have a strong research interest. So to give you an example again, as we speak, this is year 24-25, we have still students that have graduated from last year that have finished. They've taken their degree. They could have just forgotten all about us, but they stay. They collaborate with one or two supervisors from our department, and they remain as research fellows to do or complete previous studies. There seems to be a need for that internationally. There seems to be a need in particular countries where the students come from, and they wish to look from a research point of view what is going on in their countries. So this is an opportunity again for those that want to go into research are the MSCs. But in terms of what you put on your CV, as much as I would like to say, well, yes, maybe a master's is better than a certificate. Well, yes, it's a stronger degree, but if you want to professionally progress with a certificate, you will be able to do that as well. Mind you, as I said, quite a lot of our certificate students, a couple of years after their studies, they want to upgrade, which is nice to see. It means that their interest is, growing as they study with us. Again, I hope I've answered the question. Excellent. It seems like we don't have much more to discuss here. If there are questions that come to mind and we haven't answered or you haven't asked, please keep our emails and send us your questions. More than happy to meet you as well in person. If that is what you would like to do, just let me know. I would like to have a Zoom session with you, Hara, and I'll find the time and we can meet. Emiliana, I think we're finished. If that's okay.
Thank you, Hara, for a lovely session, and thank you for the attendees for very interesting questions. I wish you a good day.
Thank you. Have a good day,
Bye,
everybody.
everyone.
Bye-bye.